How to remove warts on dogs. The majority of dog warts are benign and do not necessarily require removal. Unnecessary removal could actually put undue stress on your dog, and could even trigger another outbreak of warts in the near future. If you do decide to remove your dog's warts, however, there are a few holistic remedies you can try on your own before going to the veterinarian and paying for professional procedures. Method 1. Assessing the wart. 1. Assess whether a growth is a wart. Dog warts, or sebaceous gland cysts, are actually a type of benign skin mass that appears in dogs as they age, similar to the way that moles appear in humans. Other growths can also occur on a dog's body. Some examples include skin tags, mast cell tumors, histiocytomas, hair follicle tumors, collagenous nevi, and fibromas. If you are ever in doubt as to whether the growth you are seeing on your dog is a simple wart or some other disease, consult your veterinarian. She or he can draw some of the cells out of the growth and examine it under the microscope to give you an accurate diagnosis. 2. Examine the appearance of the wart. True warts are caused by the papillomavirus and are usually found in puppies or older dogs with an imbalance in their immune system. These warts look like cauliflower stalks and typically appear along the nose, lips, or gums. The warts usually disappear after a few months as the immune system develops, but they can be contagious and make it difficult for your dog to swallow or breathe. Common, benign warts are flesh-colored and small. They tend to look like tiny mushrooms. If a benign wart grows or looks inflamed, you may need to remove it. You cannot always tell by looking at it if it is a cancerous tumor or not. Many times cancerous warts are black, quick, growing, and inflamed. They generally form around the eyelids or lips and should be removed as soon as possible. 3. Chart the growth of the wart. As long as a wart does not increase in size or change shape, you probably do not need to remove it. You should, however, make your vet aware of any warts your dog develops so that he or she can keep track of them as well. Many warts disappear on their own, but even those that persist generally remain harmless. 4. Consider whether or not the wart poses a problem. You can remove a wart merely for cosmetic purposes, but it is generally not recommended to perform surgery for that reason alone. If, however, a benign wart keeps getting snagged, causes your dog to itch and scratch, or otherwise makes your dog uncomfortable, you may opt to have it removed. Your veterinarian can also give you guidance as to whether the wart needs removal. Warts that the dog can irritate by scratching or rubbing or that rubs against a collar are best removed to avoid repeated infections and inflammation. At times itching can also signal that the wart is cancerous and should be removed. Method 2. Treating a wart holistically. 1. Chart the progress of any treatment you choose. On the first day before treatment, chart the wart. Photograph the existing wart or mole to establish a baseline. Use a metric ruler to measure the wart in millimeters. Date the photograph, circle day 1 of treatment on the calendar, and write down the measurements. As long as you are positive that your dog only has a benign, non-cancerous wart, you can try some of these holistic treatments. Remember that there is no scientific evidence supporting the efficacy of any of these methods. So if the wart turns black, grows quickly, or becomes inflamed, bring your pet to a licensed veterinarian for medical treatment. 2. Try thuja. Thuja is a homeopathic treatment made from a type of tree, and it is considered safe for most dogs. It is available in both pellet and liquid forms, and should be given to your dog orally. You only need to give your dog a single dose. If you do not see any improvement after the first 2 weeks, however, you may give your dog a second dose. Thuja can cause abortions, so do not use in a pregnant animal. 3. Psorinoheel is a supplement that includes pserinum and sulfur, in addition to thuja, which all act as antiviral agents. 4. Boost your dog's immune system with vitamin support. The wart may be a symptom of a weakened immune system, so it may disappear if you address the problems with your dog's immune system. The supplement Immunosupport contains several immune-boosting ingredients including arabinogalactans, lutein, and shiitake mushrooms. 5. Give your dog l-lysine. This is available in pill form. Give 500 mg twice a day to the affected dog until warts disappear. 6. Apply vitamin E to the wart. Use a sterilized needle or knife to puncture a standard vitamin E capsule. Apply the vitamin directly to the wart using clean fingers or a cotton swab. Repeat this procedure 3 to 4 times a day for 2 to 3 weeks until you see improvement. 7. Rub castor oil over the wart. Standard castor oil, found in most drugstores, can soften dog warts and greatly reduce irritation, which will help prevent your dog from scratching the wart open. Use a clean finger or cotton swab to apply to oil directly to the wart. Apply this treatment once every day or 2, or as necessary, to reduce irritation until the wart vanishes. 8. Try apple cider vinegar, ACV. This process is painless at first, however, towards the middle of the treatment cycle, the subject will experience mild tingling to stinging as the acid in the apple cider vinegar eliminates the growth. Do not use this method on warts around the eye or genital area. Pour a small amount of ACV into a cup. Smear petroleum jelly on the skin around the wart to protect unaffected skin. Have the dog sit or lay down so the wart is facing up. Use an eyedropper to apply 2 to 3 drops of apple cider vinegar to the top of the wart and allow to soak in. Any excess that runs off the wart can be wiped up with a clean paper towel. Keep the dog busy with a toy or petting to allow the ACV to soak in for up to 10 minutes, then let the dog go about its business. Apply ACV to the wart 3 to 4 times a day. As the treatment continues, it may start to sting as the top of the wart sheds off, but continue to treat 3 to 4 times daily until the root is reached. This will eventually dry up and fall off. When the root of the growth dries up, there will be a red spot, blister, or on the skin. Clean the carefully with clean warm water on a washed cloth, then apply coconut oil to the area once a day until the spot heal. Coconut oil has anti-fungal properties and will promote healing and regeneration of healthy skin cells. Method 3. Removing a wart medically. 1. Give your dog azithromycin. This is a type of antibiotic used to treat warts in humans, and has also proven to be an effective treatment for warts in dogs. It will need to be prescribed by a veterinarian. Treatment is an oral dose, calculated based upon your dog's weight, once a day for up to 10 days. 2. Consider a subcutaneous interferon treatment for warts caused by viral infections. This is an antiviral treatment that can be prescribed by your vet, which is available for warts unresponsive to other treatments or for severe wart growth. Your veterinarian will inject the treatment into your dog multiple times a week, or he or she may demonstrate how to inject the drug and instruct you to do so at home. These treatments can continue up to 8 weeks. While you can avoid surgery and the associated risks, this treatment can cause a number of side effects, including fever and loss of appetite. 3. Ask your vet to perform electrocautery. When performing electrocautery, also called electrosurgery, the veterinarian uses a small tool that allows him or her to apply a small, concentrated amount of electricity to the wart. This electricity burns away the contaminated tissue, thereby removing the wart. The surgery is usually performed under local anesthesia, making it a good option if you worry about the risks involved in knocking your dog out with general anesthesia. 4. Discuss the possibility of cryosurgery with your veterinarian. During cryosurgery, the vet will use a specialized tool to freeze the wart. Freezing destroys the diseased tissue, shrinking the wart significantly and, in many cases, causing it to disappear entirely. Like electrocautery, cryosurgery is performed under local anesthesia, so your dog will not need to be completely knocked out. 5. Opt for excision. An excision is the most traditional treatment for warts, but your veterinarian may need to put your dog under general anesthesia to perform it. During a traditional excision, the vet simply cuts the wart and contaminated tissue away using a medical scalpel. Your vet may opt to wait to excise warts until your dog is going under general anesthesia for another reason, since putting a dog under is an extreme measure to put a dog through just to remove warts. 6. Try laser ablation. Opt for this treatment if your dog has persistent warts that do not respond to other treatments. Your dog will need to go under general anesthesia, but laser ablation attacks warts at the root, and often proves itself to be the most powerful treatment against resistant or recurrent warts. Tips. Veterinarians can use dog warts caused by the papillomavirus to determine the current state of your dog's immune system. This can prove especially helpful in older dogs whose immune systems are more likely to develop imbalances. As a result, you may want to seriously consider leaving benign growths alone, as long as they do not cause your dog any problems. Warnings. If your dog has warts caused by a virus, you should keep it away from other dogs. This is especially true if the warts develop in the mouth. Make sure that your dog has its own water bowl and does not share it with other dogs. Also keep your dog out of dog parks or other dog-heavy locations until the wart clears up.